lots of perspective, but basically want to keep it local to Ottawa. Now, there's two types of perspective. There's like the textbook, boring stuff. Listen, you'll have that all term. I'm going to give you the street perspective. Okay, I want you guys to know what's happening on the streets, in the communities, with the drug scene that's happening, and it's a changing environment. I am not an employee of Algonquin College, though I work and they're my peeps. Okay, I'm not an employee of Algonquin College. I'm speaking to you from the Ontario Naloxone Program for Pharmacies, and that's where my perspective is from. What you do with these on campus, when you go back to campus, what you do with these in your professional life, I can't speak to, only in your personal life. I'm training you of residents of Canada / Ottawa and of the Naloxone program. Okay, so we'll get going here. So first and foremost, I'm going to share my screen and we are going to start my presentation. All right. All right, so I'm going to talk about opioids, the cards of drug addiction. And the reason why I'm going to talk about opioids first is because the opioids, unfortunately, are what's killing everybody. Okay, so opioids is what's killing everyone, and they're found in everything. Every single person on this call today will get this card in the mail, and it says anything can be cut with fentanyl and carfentanil, which means we find these two nasty opioids in every single drug in Canada. Okay, every single street drug, and actually a lot of non-street drugs, even prescriptions, have opioids, right? So I have to be very careful. They actually are everywhere. There's also a website at the bottom called stopoverdoseottawa.ca. You'll have access to that website. It's a fantastic resource for you guys. Everything I'm going to talk about today is on this card. This is an open book test. Your first one all about. Do not worry about it, okay? I want you guys just to sit back, relax, and listen to the information. Any questions, we'll keep until the end. So what are opioids, first of all? Opioids are painkillers like codeine, morphine, Percocets, OxyContin. You might have heard those names. More recently, more powerful fentanyl and carfentanil is what we're talking about. The most famous street opioid from all time, back in every single gangster movie we ever heard of, is heroin. And from a street source, people still talk about heroin. This past weekend, there has been 4 or 5 overdoses at one hospital in Ottawa that I know of with an ER physician of mine on gold color heroin, they call it. It's actually not. Unmute. Can you guys hear me now? Okay, someone muted me. I'm not sure. I think it was Sarah. Thanks, Sarah. Okay. Anyway, needless to say, heroin is what people call the opioids that are down on the streets, but actually it's not heroin. It's fentanyl. Let's talk about strengths. Morphine. We've all had morphine. You know, you've had morphine for surgeries. You've had Percocets for dental extractions. All those kind of things. Morphine and Percocet are this level. If you talk about something that's probably about 10 to 100 times stronger, now we're getting into heroin. 100 times stronger than heroin is fentanyl. And then something that's 100 times stronger than fentanyl, thus 10,000 times stronger than heroin and morphine, is carfentanil. Okay? Those are on the streets in Canada. They're everywhere. And last 3 or 4 years, most of the opioids in Canada were actually imported. They were imported from China, from Africa, from the United States, from Mexico, up through the West, and then over the East. No longer. Most of the sources of opioids now in Canada are manufactured locally. They are here in Ottawa. They're manufactured locally here in our own cities. So it's actually, you know, made in Canada type opioids that are causing problems. So that's the drug scene in Ottawa. Okay, that's the drug scene in most large urban centers in Canada. Okay, it's actually fentanyl. That's what's killing people. Now, what is an opiate overdose? Okay, so there's 2 parts of the training you have to know about. A, what an opioid is, you just learned about. Opioids are used to kill pain. And remember, opioids aren't bad medications. We cannot do modern medicine without opioids. If anybody has been put to sleep for surgery, even as simple as a dental extraction, congratulations, you have all used fentanyl, right? We can't do modern medicine without it. If your mom or your aunt or yourself has given birth to a child, you've had an epidural, then you've had fentanyl. Fentanyl is a fantastic medication, especially in advanced cancer pain and anesthesiology. Let's keep that in the back of our mind. Going to sleep for surgery is the same as an opiate overdose. Anesthesiology is the study of putting someone in overdose to perform surgery on them, okay? Now, the anesthesiologists that work with us don't like when I dumb it down that much, but that's what it is, essentially. We put you in an opiate overdose so we can perform surgery on you, okay? So opioids kill pain. But not only do they kill pain, they stop breathing. When you go to sleep for surgery, the doctor says, count backwards from 10, 9, 8, 7. Then when you're unconscious, the nurse or doctor will walk along, they'll stick a tube down your throat and hook you up to a ventilator. You cannot breathe while you're on an opioid because your breathing mechanisms, your parasympathetic nervous system is turned off, okay? So basically what is an opiate overdose? You stop breathing. It's equivalent to taking a plastic bag, placing it over your head and taping the neck. The mu receptors in the brain and spinal cord become saturated. Your breathing is depressed. Your brain becomes hypoxic, which means no oxygen in the brain. Your brain dies, game over. From the time you take a hit, whether it's intentional, accidental, spiked, till the time you're dead, is 3 to 5 minutes. Most people die of an opiate overdose with sirens in the background and paramedics en route. That is an opiate overdose. Basically, you've gone to sleep for surgery. This is Canada. If you don't know this is Canada, you are no longer welcome at Algonquin College. Just kidding, just kidding. But this is Canada. And this represents the opioid death rate in 2019 in Canada. So we have a crisis on our hands. It's COVID. We have a bigger crisis on our hand, which is opiate overdoses in Canada. Opiate overdoses, I will guarantee you, will kill more people than COVID in the next 5 years. Keep that in the back of your mind. So what it'll look like in 2019. Actually, Canada did pretty well. Overall, Canada flattened the curve for opiate overdoses in 2019. Yay us. What does that mean? 2018, we had 4,400 opiate overdoses. That's one every 2 hours. It was the highest, it was the #1 killer of accidental death among youth, okay? So it killed everybody. You know, you're twice as likely to go to an opiate overdose death funeral than a car accident funeral for someone, you know, your age group. Now, that being said, we did flatten the curve. In 2019, we lowered the rate down. We got down to 38.23. We did really well. We all did well. Now, 94% of these are accidental, so we know it's not people trying to kill themselves. We know it's accidental overdose deaths from spiking too much, cross-contamination. But overall, we flattened the curve in 2019. We did okay. That's great. But if you look at the staggering number from 2016 to 2019, over 15,000 deaths. We only lost about 9,500 people in COVID. We probably only lose about 10,500 total if we do our job this winter, right? But we lost 15,000 already to opiate overdose in the last 3 years, right? But yet we've spent billions of dollars on COVID. Where's the money being spent on opiate overdose? Where's the awareness, right? It's another pandemic, or it's another epidemic here in Ottawa or in Canada that's happening behind the scenes of a pandemic. It's absolutely terrifying. And let's speak to that for a second. So overall, yes, the country did reduce its rate a little bit in 2019. Good for us. And this is from absolutely massive naloxone distribution, except for Ontario. Ontario is the only province that had a slight increase, right? So great, we flattened the curve, right? But what happened now is that Ontario took over BC as the absolute epicenter for opioid overdose in the world. So first of all, Canada consumes the second most of opioids of anywhere else in the world, okay? So we're number 2. And of that, Ontario is the epicenter of opioid use in the world. So we are actually the Wuhan of COVID. We are actually the worst place in the world for opioid overdose, okay, is actually Ontario, right? That's staggering. That's amazing. Most people don't even know that, right? And you can tell that by 2019, we still increased the number of deaths. We flattened the curve down a little bit. It goes 8 to 12 to 14, now only a little bit higher to 15, but we still increased. Now that's 2019. Let's fast forward to 2020. So the first 6 months data is just coming in, and what we estimate is a 25% increase in opioid deaths over 2019, and that's across the country. Why is that? COVID-19. It is terrifying. Why is that? Fear, isolation, loneliness, and money. CERB, payments. People got cash, and here's my little conversation. I'll give you personal history. During COVID, I might have had a few more beers. I might have eaten some more junk food. Somebody with opioid use disorder, what did they do? They used more opioids. And what did they do? They used them alone. There was no one there to save them. They were in isolation. They were asked to social distance. The social supports weren't there. We are going to see probably over 5,000 opioid deaths in 2020. It is absolutely terrifying. This is current. And a weird number in Ontario, 1 in 3 is in the construction industry. So any of you guys Algonquin doing your trades, anybody that's going to be working in the trade industry at all or dealing with construction workers, 1 in 3 opioid overdoses are in that industry. Now, how do we flatten the curve in 2019? Absolute massive numbers of naloxone distribution. Naloxone kits are the kits that save people's lives. They're like it's an opiate antidote. We'll talk about that in a second. But what you need to know is that the reason why we did massive government awareness, programs just like this, and the largest number of kits put out there. Now, Thunder Bay, congratulations anyone from Thunder Bay. You guys have the highest number per capita of 100,000. However, we here at Ottawa Public Health, and myself and Sarah, and people just like us, we are the reason why we have the highest number of naloxone kits per opioid harm. 38.1 kits out there per opioid harm that presented to emergency department. That is pretty awesome. That's a really good number. You want that number to be as high as possible. Now, that means we are the best in the province at putting kits out there per opioid harm. Congratulations. However, really, it meant nothing. Why? The coroner told me for 1 in every 4 opioid deaths, for every opioid death in Ottawa in 2018/19, they only found naloxone 1 every 4 times, which means I'm missing 3/4 of the people, and we're putting out more kits than anybody. So if we are the best, we are the best region. Ottawa is the best region in all of Canada for putting naloxone kits out per opioid harm, and we're only catching 25% of the opioid deaths. We got a lot of work to do, right? Us as a community, everyone on this call today has to put more kits out there. For every 25 kits I put out there, 1 is used. So let's talk about this. On this call, there will be definitely more than 25 kits put out there, which means somebody who's listening today will actually save a life. Keep that in the back of your mind. This is a slide I added. Look at this. The red line is overdose deaths. The blue line is COVID deaths. Where is the real problem? That's BC. Crazy. Ontario's worse. All right. Now, a part of the opioid training, opioid overdose training and naloxone training is you got to be able to recognize the signs and symptoms. Once again, Algonquin, because I love you, you guys are getting an open book test. The back of these cards I've given you, okay, are the signs and symptoms of opioid overdose. Sit back, listen, they're all coming your way in printing, okay? I'm going to talk about all the symptoms in literature. I'm going to talk about the ones you see in textbooks. And then I'm going to pick out the 4 that I see more often. I've given out thousands and thousands of kits. Remember, every 25 they give out, 1 is used. So at my centers, I've got a lot of feedback from clients about what they actually see in the streets. I know someone who used an naloxone kit this weekend, and they gave me feedback on Sunday afternoon at the Byward Market location about what they seen and why they used an naloxone kit. I'm going to give this feedback to you right now. Okay, the first symptom you're going to see in opioid overdose, in the literature, they say decreased level of consciousness. That's a polite way of saying you are ready for surgery. Most guys walk into the pharmacy and their faces are mangled because guys are wailing on them to try to wake them up. We don't do that anymore. We stopped that, even on Carleton students, okay? We stopped that last year. Nobody punches anybody in the face anymore, okay? I'm just joking, but really do not do that. But you need to understand that I could do a freaking knee replacement on somebody. They are unconscious, ready for surgery. That's the level of consciousness we're talking about. At safe consumption sites downtown, the angels that work there will say things like, the difference between giving someone NARCAN and someone not getting NARCAN is their ability to respond to stimuli. If they can grunt, groan, moan, put their hand up, they don't need naloxone. You might need to call the ambulance because they're going to slip an overdose, but they're not quite an overdose. Once they lose consciousness, that's the first symptom of overdose. The next one is pinpoint pupils. The black part of your eye becomes non-existent. All you can see is the color part. If you're a Walking Dead fan, or if you're a fan of Game of Thrones, you know, the White Walkers and the Walkers, or, you know, the Guardians, those guys, these guys are the actual ones you look like. All you can see is the color part of your eye. So blue-green eyes, very distinctive. Black, dark eyes, harder to tell, right? Brown eyes, my eyes, very hard to tell. Bright blue and green eyes, you can really tell. It's very distinctive. Then you start to gurgle and snorting sounds. This sound is the body gasping for air without the mechanical ability to breathe. Remember, your parasympathetic nervous system is shut off. You can't breathe, right? So it's the same sound as if I took my hands, placed them around your neck, and choked you out. Except there's no hands around your neck. You're gasping for air. It's a gurgling, choking sound. Then your lips turn blue. First your lips, then your whole face turns blue. Your fingertips, then your whole hand turns blue. If you are black, indigenous, dark complexion, Middle Eastern, dark skin tone, it's gray. It's not blue. Blue is for fair people, light skin, it's blue. So it's blue or gray. Limp body. If you don't mind, I'll skip over that stupid symptom in the literature because you're ready for surgery. Of course you have a limp body. You're unconscious. Next is vomiting. Now, you don't really vomit. You don't have the muscular capacity to vomit at this point because you're unconscious and your parasympathetic system is shutting down. You don't vomit. When I ask 911 call center people, what do you hear on an opioid call? They said foaming at the mouth. So white cottage cheese mixture that comes out of your mouth is called foaming at the mouth. This is dangerous. Those overdoses I mentioned to you this weekend, they all ended up in ICU because they had aspiration pneumonia. This white foam stuff went into the lung and they had to be put in ICU for a while and given antibiotics. And the last symptom that happens is this neurological response called the funky chicken on the street, but basically you're shaking. Your muscle cells are deprived of oxygen so fast, especially with the most potent opioids like fentanyl and carfentanil, you actually start to shake, like you're having a seizure. You shake. You could be found rigid and having trouble opening your mouth because the jaw's clenched. That's what it looks like. It's very ugly. So there are all the symptoms. That's all of them. Now let's talk about what you actually see. And when I ask somebody, you gave naloxone yesterday, you gave naloxone this morning, what did you see? They say pinpoint pupils, gurgle, blue lips, funky chicken. That's what they talk about. That's the 4 I want you to remember. It's called a clinical pearl. You remember those 4, you're golden. All right. Now, who's really at risk? Among your friends, your family, your classmates, your teachers, your professors, who's at risk of an overdose? Okay, who's really at risk of an overdose? And there's a whole bunch of literature. We know 1 in 3 in the construction industry. People prescribed opioids, you know, those kind of things. I can talk about all the medical stuff, but I like to prefer the street perspective risk factors. The first one is the patient factor. Number 1 cause, loss of tolerance. Now, the number 1 time for overdose in this city, in Ottawa, and in major cities across Canada is Frost Week. This is the week where everyone overdoses. Why? They're away from mom and dad. They have a pocket full of cash. They've been working all summer, and they're experimenting with drugs and alcohol, and everyone ODs. So in a normal circumstance, when everyone's back on campus, this is when the overdoses are happening most often in our city, right? And this is because of no tolerance. Why? If you thought you were smoking marijuana and it was laced with fentanyl, you will overdose. If you thought that you were doing a line of cocaine and it was laced with fentanyl, you will overdose. You have no tolerance. You haven't been using opioids. Okay? Even if you thought you were doing a small amount of fentanyl and it was laced with carfentanil 100 times stronger, you will overdose. This is what's happening. But not just street use. Think about people on prescriptions. If a grandmother makes a mistake with her own prescription and she doesn't take it for a few days because she has dementia, and then she takes it on Thursday, she will probably overdose, right? Or a baby crawls across the floor, picks up a tablet, places it in the mouth, they will overdose. This is loss of tolerance. Other medical problems, people with complicated medical histories, liver failure, kidney dysfunction, people with breathing issues because it already affects your lungs. People with COVID are at higher risk of opiate overdose. If you use alone, this is also COVID. People in isolation, people using alone, people with shame of the drug use, you will overdose more often because you cannot use naloxone yourself. You are ready for surgery. You are completely unconscious. And if you've had a previous overdose of any substance, you are more likely to overdose again. Why is that? The reason why that is that people who are addicted to opioids and use them chronically especially don't necessarily just use them to kill physical pain. They use them to kill mental pain. Of all the drugs on the streets, I say this over and over in every single lecture, the best drug at turning off the brain from trauma, from post-traumatic stress, from childhood rapes, from being beaten to death, from your mom and dad, watching your mom and dad die, from any trauma you've seen in your life, the best drug at turning off that brain, unfortunately, is opioids. The problem is, and you know, they'll describe the hit of the opioid as a warm blanket, warm hug, liquid caramel. They have very powerful literature to describe the hit of the opioid because that's when they feel the hug. But where the hug is the tightest and the blanket is the warmest is about 2 breaths per minute. They are almost dead. The problem is now, where the drugs are so potent, they can't tell the difference between feeling comfortably high on the nod, feeling that hug, escaping that mental trauma, and death. The fine line between the two is almost impossible to tell. And this is why people overdose again and again and again until they get better. Now, to treat a mental health disorder like opioid use disorder, because using opioids chronically in any addiction really is not a character flaw. It's not a moral insufficiency. It is actually a true mental health condition. And to treat that properly takes 15 years. 12 to 15 years before you're even stable enough not even to use the chemical for long, long periods of time. And in order to treat that, in order to keep people alive to treat that condition, it requires a lot of naloxone. And if you have one overdose, you probably have 20 before you're actually fixed, especially opioids. That's where we are right now. And then with the drugs, they are stronger than ever. Look at this slide. On the right of your screen, you're going to see 1 inch. On the left of your screen, you'll see 3 vials. This is known as LD50. So if every single person on this call took that much heroin, half of us would die. If everyone on the call took that much fentanyl, half of us would die. If everyone on this call took that much carfentanil, which is in our cities in Canada, I'm not talking LA or New York or somewhere different. I'm talking about in our cities, in our communities. If we all took that much carfentanil, which is a few grains of salt, half of us would die. That is cross-contaminated everywhere. People can't control it. This is why the opioid overdose crisis we are in. Okay, that is pretty heavy for day one. Okay, so let's talk about some good stuff here. Can
I stop you for 2 seconds? Okay.
Sure.
So I just want to let folks know, yeah, it is heavy. Anyways, we're here for counseling if anyone needs, but that wasn't the point of why I jumped in. One thing I need to say is that our team who put the day together, we love them, they're fantastic, but they forgot to ask everyone for their addresses. Now, I don't want you to send them in the chat where everyone can see, but I'm going to privately message every single person on this call and ask you for your address. So click the bottom where it says chat, and then you'll see the red word private, and I'm going to take all of your addresses so that we can send you a kit. Okay? Sorry for interrupting. Thank you. Good day.
No problem. I cannot send you a kit if I don't know where you live. Okay? I'm good. Not that good. Sarah's great. Not that great. It's impossible. Okay. Before what we do, we just give them out to you on campus, which is lovely, but we can't do that this year. I'm going to mail you this through FedEx. Okay? You're going to get some information, like I mentioned. You're going to get 2 naloxone kits in the mail so you guys can all be superheroes. Okay? So important. So what is naloxone? Naloxone is NARCAN nasal spray. Okay? It is the EpiPen for opioids. We all know what EpiPens are, right? They stop anaphylaxis reactions like peanuts and tree nuts, and everyone seems to be allergic to everything right now, right? It would suck if you were allergic to masks, but you're not, hopefully. Okay, now here's the thing. This is NARCAN nasal spray, okay? It is like the EpiPen for opioids, except it's a nasal spray, okay? But it's an opioid antagonist. There's 1 spray per device. Each device has 1 spray only. It's already primed, ready to rock and roll. But it doesn't clear the drug from the body. Like an EpiPen doesn't clear peanuts from the body, right? NARCAN doesn't clear the opioid from the body. It doesn't make you pee it out, poop it out. You're not going to clear, you're not going to pump your stomach. What it does, it goes into the body, in the bloodstream. It goes to the lung. It removes the drug off the lung and brainstem, allowing you to breathe for a short time until paramedics get there. I mentioned to you earlier, most people die with sirens in the background. This is going to keep the person alive until paramedics get there. Okay? Each nasal spray themselves is 4 milligrams per spray. About 2 milligrams gets absorbed in the body. And it only takes 2 to 4 minutes to start working. It's amazing. And the person doesn't even have to be breathing well for it to work, or even breathing at all. It is amazing. Okay, so the person is almost dead or dead. You roll in, 1 spray in the nose, they wake up, paramedics save their life. It is absolutely incredible stuff. It works that well. Now, a lot of people are worried about the effects of naloxone. Listen, if I give this guy stuff, and I've taken away his warm hug that you told me, I ripped the blanket off him, as you mentioned, he's gonna be pissed off at me. More often than not, this doesn't happen anymore because the opioids are stronger than ever. Some guys don't even regain consciousness. Some guys need 4 or 5 sprays to even wake up. What you're doing is making sure you have the maximum amount of oxygen to that brain until paramedics get there. That's your goal. Hopefully they jump up and give you a big hug. They may not, all right? They may wake up anxious and nervous because they just woke up. They weren't expecting to overdose. But overall, you have called 911, you've got support on the way, things are gonna be fine. And remember, it only lasts between 20 and 40 minutes. The literature says 1 hour. That's not true. It only lasts 20 to 40 minutes, okay? And most people will slip back into overdose and require more NARCAN. The best thing, it is completely safe. It is by far the safest thing that as a pharmacist I will give out in a day. It is safer than an EpiPen. And we strap them to kids and let them run around. This is safer. It's just a nasal spray. It's very low invasive. I NARCAN myself in front of my children just to show them it was inert. Nothing happened. Except my wife called me an idiot. That's the only thing that happened. Other than that, we're good, okay? It is completely safe. Nothing to worry about. Even pregnancy, we use it. We give it to babies. I've seen people NARCAN their dogs. Now, let's talk about the process. How do I use an naloxone kit? How does it work? So I'm going to end my show here for a second. I want to show you a video from our website, naloxonecare.com. It's a training video. It's 3 minutes to show you what it looks like. And then after that, I will come back and speak to you about it again. In 2018, 1 Canadian died every 2 hours from an opiate overdose, and this number continues to rise. It's not just heroin or fentanyl users in the streets, it's grandmothers with their own prescriptions, and kids who didn't even know they took an opioid. My name is Mark Barnes. I'm a pharmacist and the owner of NaloxoneCare.com, an interactive website designed to allow more Canadians access to life-saving drug naloxone. Naloxone is the drug that's found in an easy-to-use NARCAN nasal spray. It can reverse the effects of an opiate overdose in as quick as 2 to 3 minutes. After you complete a simple training and answer a few questions on this website, we can send you a NARCAN nasal spray kit directly to your home. So what are opioids? They are painkillers such as codeine, morphine, OxyContin, Percocet, and fentanyl. Recently, much stronger powdered fentanyl and carfentanil are leading to accidental use and overdose because they are so small and hard to detect if mixed with other drugs. With this NARCAN nasal spray antidote, you can deliver 2 milligrams of naloxone directly to the bloodstream. Although naloxone can reverse the effect of an opiate overdose, it cannot remove the opioids from the body. It's important to call 911 after you administer the spray because in 20 to 40 minutes, the effects of naloxone will wear off and the person will slip back into overdose. The time it takes when an opioid is ingested to overdose and death can be as quick as 3 to 5 minutes. Which is why it's so important to recognize the symptoms quickly. Here are the 4 major symptoms of an overdose. Unconsciousness. The person is not moving and cannot be woken up, even if you shake or pinch them. Pinpoint pupils. The person's pupils are small and hard to detect. Snorting or gurgling sounds. The person can be heard gurgling or choking, and breathing is shallow or undetectable. Blue and gray lips. The person's lips turns blue or gray. Other symptoms include cold, clammy skin, foaming at the mouth, and shaking. Every naloxone kit you order from naloxonecare.com includes a case, latex-free vinyl gloves, a CPR mask, 2 doses of NARCAN nasal spray, an identification card letting everyone know that you've been trained to use naloxone, and instructions. We like the 5-step approach to respond to an opiate overdose. Step 1, shake and shout. Assess the person and remember the major symptoms of an overdose. Step 2, call 911. If the person is unresponsive, call 911 right away. Step 3, administer the naloxone. Lay the person on their back. Remove the device from the packaging. There's only 1 dose per device, which is ready to use, so do not test or prime the device. Tilt the person's head back and provide support under their neck with your hand. Gently insert the tip of the nozzle into the nostril. Your fingers should be right up against the nose. If giving to a child, make sure the nozzle seals the nostril. Press the plunger firmly with your thumb to give the dose. Remove the device from the nostril. Step 4, chest compressions. Start CPR as it takes 2 to 3 minutes for naloxone to start working. If you have an AED, use it. If not, push on the center of the chest. This pushes any of the oxygen left in the body to the brain and circulates naloxone to the areas of the brain and lung to start working. Step 5. Is it working? If you do not hear a deep breath in 2 to 3 minutes, then go back to step 3 and administer a second dose of Narcan nasal spray found in your kit. Once the naloxone is actively working and the person is breathing on their own, put them in the recovery position. The recovery position helps open the person's airways and avoids choking on vomit or spit. Remember, naloxone only lasts 20 to 40 minutes, so an overdose can return. It's important to get the proper medical treatment. Tell paramedics everything you know about the situation so they can provide the best care. Get trained, get a kit, save a life. Okay, that's the video there, guys. So now I want to go over this again quickly. Okay, so you talked about in the video, great looking fellow there tells you everything you need to do. Okay, the first thing is you do your assessment. You look at the 4 major symptoms I talked about, right? Pinpoint pupils, gurgle, blue lips, starting to shake. Then you grab your naloxone, okay? You carry your kits everywhere. Mine come in pencil cases, not because you guys are at college, but because my guys want something that's pliable, small, easy to put in their pockets, okay? And that's why I carry them. Most people don't want a big, hard, rigid case that says naloxone, okay? Most people, guys, just want a spray. Put them in your purse, put them in your wherever. This is the most important component, okay, is the Narcan nasal spray itself. You grab your kit, you've done your assessment. You call 911 first, you tell them where you are, you have an opioid overdose. When you say opioid overdose, they know who to send, what to send. Advanced paramedics, very big deal, you say an opioid overdose. Then you grab your naloxone, okay? Your naloxone itself, you peel it open. It does not work unless you peel it open. So important, okay? I'm trying to make it exciting, it's a nasal spray. This is what it looks like. You have the two sides and the plunger in the middle, right? Inside here is a glass canister. You grab your nasal spray, you place it in the nostril, up the nose, towards the eye. The reason why you twist towards the eye, your sinuses are gaping holes on your eyes. And you spray. And you see, I sprayed it, it went 2.5 feet in the air. If that was inside the nostril, it attached to the sinus. It's being absorbed. But we want this to work in 2 minutes, not 4 minutes. This part's important. In order for it to work 2 minutes, not 4 minutes, you have to start chest compressions. You notice I'm not mentioning breathing. During COVID, the Public Health Ontario has told everyone, and Canada has agreed, that the best way to respond to an opioid overdose during COVID is not to do the breathing. And to be honest with you, before COVID, I didn't recommend breathing anyway. Why? The breathing mechanisms are turned off. They don't work anyway. The only reason why some people suggest breathing is because in case you're wrong and it isn't an opioid overdose, it's a regular heart attack. But if you have an AED, this is when you use it, okay? What that does is that pushing on the chest or the AED drives Narcan to the brainstem of the lung for it to start working, okay? And it works fast. That's because it's gonna work now in 2 minutes, not 4 minutes. And when it kicks in, you hear a sound that's heard every single time. This is what it sounds like. You hear a gasp for air. When this parasympathetic nervous system is reactivated, the Narcan is taken off that mu receptor, or the opioid is taken off that mu receptor by the Narcan. It works. You hear a big deep breath, great. If you don't hear that deep breath in 3 to 5 minutes, really 2 to 3 minutes, you grab a second nasal spray. Because as you notice, this first nasal spray has been used. The plunger's gone. This here has been pushed up and the canister's been punctured and broken. It's done, okay? You grab a second Narcan nasal spray, you place in the other nostril. Remember, nostril, twist towards your eye and spray again. That's what it looks like. You keep doing spray, chest compressions, spray, chest compressions until a paramedic tells you to stop. Everyone on the call today is getting 4 sprays. Okay, you're getting 2 kits, 4 sprays sent to you. I never give less than 4. If you want more than 4, indicate with Sarah on an email. She'll let me know. I threw Sarah in the bus. See that? That was great. So that's what I do, okay? Simple as that. You want to make sure you have enough Narcan nasal spray. If you're in an urban center, you might want to carry 2 or 3, right? I always carry a minimum of 2 kits around because you may need more than 1 spray. There's been anecdotal people who have high resistance to opioids that require more than 2 sprays, more than 3 sprays. And remember, it only lasts 20 to 40 minutes. So if you're at a cottage in a rural area and you're an hour from the hospital, you'd give 1 spray, you keep the guy alive for 20 minutes, then you give another spray when he slips back in overdose, keep him alive for another 20 minutes, another spray, and then all of a sudden you're at the hospital. That's how that works. Before you ask, the Good Samaritan Act covers you for Narcan nasal spray, okay? The Good Samaritan Act says opioid and says Narcan. Every single province and jurisdiction in Canada has a Good Samaritan Act that says opioids, that says Narcan. What does that protect you against? As a first responder, it protects you that if you mess up and the person dies anyway, no big deal. Okay, you're protected legally. You will not, you know, I guess, be subject to litigation at that point. It also protects you that if you're there and you've been dibbling a little bit of opioids yourself, you've been doing drugs, that you're not going to be persecuted for any kind of drug offenses while trying to save someone or call 911. So basically it says, A, you can try to save them, no issues. And you can call 911, no consequence. Paramedics have never been called to testify in a drug trial in Ontario, ever. It just doesn't happen. That's ugly. Okay, so a Good Samaritan Act will protect you. Now, if you're wielding a handgun and shooting it off, you're probably going to get in trouble, right? But if you're just doing drugs, no big deal. That's important for youth especially, that they're not going to call mom and dad. They're not going to get in trouble. You're just going to tell you to clean up your stuff and get out of there, right? That's it. Paramedics don't tell anybody. They have blinders on. They go in and grab the body and leave. Now, getting naloxone in Canada. How do you do it? Every single province in Canada has their own naloxone program. We are super fortunate that in Ontario, and anybody who's on this call who says they're from Ontario will get a free naloxone kit underneath the publicly funded naloxone program for Canada, for Ontario. That's awesome. You can also go to naloxonecare.com and get retrained. So that website I just told you, you can go and get retrained. Now, I used to be able to mail out kits anywhere in Canada, but the government asked me to stop that because I'm afraid I'm going to bankrupt them, I think. So anyway, needless to say, if you're Indigenous, and which a lot of people at Algonquin College are, which is wonderful, then you can get a free NARCAN kit on your Indigenous status card. Awesome. Anywhere in Canada. And I can ship them to any northern community for Northern Indigenous. It's really wonderful. Wonderful. Now, the best way to get naloxone, if you want to get it mailed to your house in this situation and not go to a pharmacy, then you can just email me at mbarnes@respectrx.ca. For the purpose of this call, for today's purpose, you give your address to Sarah, and I'm going to send you 2 kits automatically. For future, you want those kits replaced, you need more support, you want to know more about our treatment centers, then you email me at mbarnes@respectrx.ca. I'll be happy to reach out to you, okay? Now, last thing I will mention is in that 5-step process, which it is in your kits, the 5-step process, there should be a number 6 at the bottom here, which is self-care, okay? If you have to save someone Narcan, you almost watch someone die. You have been through a traumatic event. Don't devalue or discredit what you just been through. It is stressful. It is traumatic. I want you to seek advice. There's tons of resources at Algonquin College for you to talk to someone about this, or seek the love and support of loved ones if possible, or friends. You cannot go through something like this by yourself. And if you did, great, wonderful, awesome. But if you do need support, please do not be ashamed. First of all, high five to you. I'm proud of you for using the naloxone kit because you've saved a life. It's very easy for me to stay here and say, look at me, I've getting all these naloxone kits. How many lives I've saved? I've done jack. The person who uses the naloxone kit is the real hero, and I'm super proud of you even before you even done it, okay? Because A, you've been to my training, and you're now prepared. That's awesome. You are ready to act in the event of an opioid overdose. I'm super proud of you. So now I'm done the formal part of my presentation. So if you have any questions, I'm gonna field them through Sarah. That's possible. It worked well last time, and we'll go from there. Any questions, Sarah, coming through? You're probably gonna have to unmute yourself.
You know, so I'm really trying to manage all of your addresses plus all of the other things. So one of the things that I'm asking folks.
No problem.
Yeah, so people are sending me like a message with their name, then 5 minutes later a message with their postal code. Can you just try and send it all together, because they all go in a row and I have like 500 messages. That is my request for you if you haven't done that. Okay, if you haven't sent your address to me, our international students, unfortunately, we cannot mail the kits to an international address.
Yeah, that's just being inside Canada. Now, that being said, the minute you are back in the province, you're getting a kit.
Yeah. Okay, so one of the questions is, does it make sense to just get a naloxone kit if you throw it in a backpack just in case?
Right. So let's talk about stability. It does make sense to have it, but remember, they're stable from +5 to +40 until expiry date. I think yours will expire. I'm going to send you out. I think it's April 2022 now. Okay, that's when they expire. That being said, they're stable, frozen and thawed for up to 4 weeks. Okay? So if you happen to freeze it by mistake, or it's at a cottage or whatever, no biggie. Okay? You're skating on the canal, whatever, and it froze, not a big deal. Just you email me, mbarnes@respectrx.ca, say, hey, mine froze. I need a replacement. I will send you 2 more.
Awesome. What do chest compressions do to help with naloxone distribution?
So what it does is that you spray it in the nose, right? So when you push on the chest, you're not just pushing blood out of the heart. You're actually getting the whole circulatory system moving, right? So when you push on the chest, what you're doing is that you've just attached that nasal spray to the membrane inside your nose. So that's already accessing the bloodstream. Inside your nose, there's a thin membrane, and it's between your blood supply and your sinus cavity. That's why when you punch someone in the face, they get a bleeding nose so easily, right? So what you've done by touching the mucosal membrane is that when you push on the chest, you push up into the bloodstream and it circulates to the heart as fast as possible.
Someone asked if you could re-mention the site for training in the future.
Yes, training in the future is naloxonecare.com. And I'll have Sarah put it out in an email to all you guys, naloxonecare.com.
I'm going to send an email to everyone who did it.
And actually, guys, I just remembered, idiot that I am, I should probably do a better job marketing myself. On the cards inside your naloxone kit, there's a website called, you'll see it there, naloxonecare.com. I'm an idiot. Forgot to have it in there. So there you go.
That's very helpful. Okay. If anyone didn't send me their kit, please, or their address, please give it to me. If you don't know how, when people are getting off, we can do that. But does anyone have any other questions for Mark? I know there's a lot of information you all learned. You're welcome to ask them. Oh, hey, no, Luke, your hand's up. You can unmute yourself. Oh, you're still muted.
You mentioned your email address, and I tried writing it down, but you went too quickly and I couldn't write it.
Okay, so it's M Barnes.
Okay.
I'll share the slide again if you want me to.
I'll send it in the chat as well.
Let's see here if I can do this.
Respect RX, right?
Yeah, it's mbarnes@respectrx.ca. You can see it there now.
Oh, no, I said .com. Sorry, people. I got to.
It's .ca. We live in Canada, sir.
I know, but Algonquin College is .com. Isn't that crazy? Wild. It's a wild place.
mbarnes@respectrx.ca, guys. There you go.
Yeah.
Awesome.
Does anyone have any other questions?
Was it pretty clear? Yeah.
Did I give you my address already? I think I did.
Yeah, I think you did. Did anyone not send me their address?
By show of hands, how many people here learned something new today?
Awesome.
How many people here by yes or no knew that the opioid crisis is so bad in Ontario?
No.
We're actually the epicenter of the world. Isn't that embarrassing? Actually, it's actually been mentioned by the World Health Organization, our province, which is like embarrassing as crap. That's why the government of Ontario actually made our nasal spray publicly funded, right? In other provinces in Canada, like Saskatchewan, unfortunately, Manitoba, I believe Alberta and BC, both only have the old-fashioned injections, which you have to crack an ampule, draw a syringe, and inject somebody. It's terrible. People die trying to give it an injection. It's not cool, right? So we're very fortunate, and when I speak to my counterparts in other provinces, we're very fortunate to be able to have a publicly funded nasal program. And if you're not from Ontario, then don't tell me you're not from Ontario, because you're getting 2 nasal sprays because you're at Algonquin College. And I actually have a donation amount, so we're good. But I'm very proud of you guys for all coming. Thank you very much. You've done the first step in saving someone's life. Does anybody here in a faculty such as paramedics, fire, police, social work, nursing, that probably are going to have to use this in their life? Can you show of hands? Yeah, so it's a few of you guys. Excellent. Yeah, you'd be surprised in a professional capacity how many people done this. I've had OC Transpo bus drivers use this stuff. I've had social workers, nurses, occupational therapists, receptionists at a dental office, dental hygienists. Ottawa Public Health gets 600 calls a year of somebody who's used NARCAN to save a life. That's 2 a day, right? You would not believe the stories you get. And I love the heartwarming stories. I got a text on my phone a little while ago. Hey, Mark, one of my maintenance staff at Ottawa Community Housing just using a naloxone kit to save a life. You know, so like those are heartwarming, right? My personal story is that I dispensed the fentanyl patch to a dying cancer patient in 2012. That cancer patient, in turn, sold that fentanyl patch to a 19-year-old romantic who overdosed and died. It was one of our first overdose deaths in Ottawa. And from that day forward, my job is to prevent overdose deaths since then. I sold Westboro Pharmacy, opened Respect RX Pharmacy to make sure that this never happens again. If that kid had a NARCAN kit with him at that party with his brother, he'd still be alive today. And I want to make sure that you guys all take him to your parties. It's so important.
Yeah.
Can I just comment? Because Mark, you're awesome. I learned a lot, and I've been working in this field for a long time. But I just want to highlight, because there's a lot of like marginalized population stories.
Yes.
This is everywhere. So like
Yes.
when you're going to a party and well, maybe not now, but wherever you're going, you know, there's a tendency to think like it's not going to happen to me, but carry it, because it's everybody. Like I know, you know, a good friend of my son's good friend died from an overdose. And, you know, that's somebody who played sports and, you know, came from a good family and all of this stuff where you wouldn't expect it. So I just don't want you to walk away thinking it's only marginalized people. It's like,
correct. No.
Yeah.
And the thing is, a lot of times I get rid of the risk figures there. When I do this presentation for health professionals, they want the old fashioned risk factors, you know, male, 40 to 39, blah, blah, blah. I stopped doing that crap because really every single Canadian is at risk of overdose. Okay. If we are seeing one every 2 hours, you're more likely to see this, like, because it's grandmothers, it's babies, it's people in hospitals. It's, you know, I've got clients that are doctors and lawyers and pharmacists and nurses and university professors. Like, this is not, opioid use itself, because it turns off the brain for trauma, is not just a homelessness population problem. This is not just a socioeconomic low income problem. Is it prevalent there? Yes, it is. Is it prevalent in other populations? Yes. The largest number of overdoses in Ottawa aren't just the downtown core every time. Sometimes it's Barrhaven, sometimes it's Canada, sometimes it's Stittsville, okay? I owned a pharmacy in Westboro Pharmacy, okay? So Westboro is one of the richest neighborhoods in Ottawa, richest, whatever. I don't give a crap about that stuff. Westboro itself had 85 addiction clients at my pharmacy. This problem isn't just a poor person problem, a homelessness problem, okay? And most people who die in overdose aren't in shelters and homeless. It's actually people in their own apartments who have employment, right? 1 in 3 in the construction industry. These guys are tradespeople who are, you know, been to college and own their own businesses, okay? This is an everybody problem. This is a society problem. And until we actually change our perception on that, things will never get better.
I think both of you like brought a really important part, and someone else commented too, like it's better to have it and not need it than not have it.
Right.
And that's one of the things people are like, so many people I know are like, oh yeah, I have an naloxone kit. And I was like, well, did you bring it? No, it's in my bedroom. Well, are you overdosing in your bedroom? Like, and if you are, you're likely alone and you can't save yourself. So it's not doing any good keeping it at home. I always keep one. I mean, I live in a condo by myself, so I have one here, but it's me. And I keep one at the cottage because there's lots of young people next door. I keep one in my car. I keep some in my office. Like, I keep them everywhere. And if anyone ever needed one, I would be so happy to have them.
We actually, working with St. John's Ambulance, but put these in public spaces, right? So we really want to put them in like, kind of like you smash the thing to get a defibrillator, you smash the thing to get an naloxone kit. It's one of those things we do. I can't stress enough that you have to have with you in order for it to work, right? And remember, like, I remember a group of addiction physicians. I know addiction physician that I know that go smoke weed once a year at this cottage thing. I'm like, you guys get your weed from like a government supply store? They're like, no. I'm like, are you guys carrying naloxone? No. I'm like, can you imagine if a bunch of addiction physicians overdosed and died? Like, really? Guys, come on. Like, you got to carry it. And they're like, okay, give me some naloxone. Like that, you know, not even, so there's a physician not even taking the time to think about, okay, there is a chance for cross-contamination in our society, and they are working the industry, right? One is an anesthesiologist, right? Like, come on, bring naloxone, right? So, and this is kind of where we are right now. So in society, it's more of an awareness, right? I'm passionate about it, too much so. My kid can't walk down, you know, I live in Carleton Place. When he was a younger fella, like 8 or 9 years old, we were walking down a path. I tell the story often. And as I fell asleep on a bench, having a nap in a nice, beautiful day, He looked at me and said, quick, Dad, NARCAN. I'm like, dude, he's having a nap, chill out. But still, there's an example of someone who's aware, right? Like, hey, listen, he's unconscious, Dad. You need to do something. I'm like, well, no, he's just having a nap. He's good. So, but there's an example of, you know, my kids being aware. This happens in schools a lot too. And there's a big fear among administrators in education that, especially in school-age children, that this is not a problem, right? This is never going to happen. But the thing is, if you train a child who's like 7 years old how to use NARCAN, they can save their mom and dad, right? And that's something that we've seen. I did a presentation one time, and it was one of the most captivating things I did. It was with Boy Scouts, and they wanted to see a treatment center. So they thought it was kind of cool. They live in an inner city kind of area, and I know that's kind of the whole marginalized, stigmatized part of it. But they rolled into my treatment center one night after work, and I gave them all a presentation, made someone pee in a cup. You know, they all thought that was fun. We dipped the urine. You know, they thought that was kind of cool. But when I was doing my presentation about naloxone use, there was a little boy in the front. He's about 9 years old, and his eyes never left me once. And his questions towards me about using naloxone, I knew for a fact he's going home that night to use it on his mom and dad. It was absolutely, his eyes locked with me. The question he was asking, like, you know, if I put it in the nostril and spray it, but I won't remember which nostril I used. I'll be nervous if I had to push on his chest. Can I leave it in there so I know which nostril I use? That's the kind of questions he was asking, as if to think he's going to use this, right? So, you know, you never really know. You can't judge a book by its cover. So you just carry naloxone, and you never know who's struggling at home.
Yeah. And so that's the thing, like, people are like, oh my God, heartbreaking, right? It's hard. And that's one of the things, is that, like, addictions, there is no person who is an addict, right? And that's one of the things, like, when we talk about people, it could be anyone. I know some people have to leave, and that's okay. You're welcome to leave at any point. Make sure you've sent me your address if you want a kit. But again, like, remembering that anything can be laced with fentanyl. And so that's why it's important, because this can really affect anyone. I also want to mention too that if anyone needs, I know the session can be like a little bit heavy and hard. So I'm going to just post the website for counseling. All students are able to access free counseling services, which is fantastic. So if anyone needs, please contact them. The counselors are all online this year, so you're able to book an appointment. We've got group sessions. The other lady who was here with the short hair, she is one of our group counselors, so there's groups running all the time. Me and her do lots of events, so we just want to make sure that people are feeling connected and supportive. The website for counseling's there. You're able to make an appointment, so if anyone needs, there's that. But hopefully we'll see you at some of our events coming up, and thank you everyone for coming. And thank you, Mark, for doing this. Hopefully everyone sent me your address. I'm going to send an email anyways to all the participant list. But yeah, okay.
I really appreciate it, guys. Thank you so much. Remember, get a kit, save a life. And if you do, I'd love to have the feedback of your experiences at mburns@respectrx.ca. You guys are all champs for coming. Sarah, once again, love you. You're awesome. All right, take care, guys.